Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
The teenage years are a time of transition for youngsters during which they encounter many changes and uncertainties. Teenagers are particularly perceptive during this time, which is marked by behavioral changes and emotional unease. What happens though if this emotional turmoil becomes too great or if extreme distress leads to risky and dangerous behavior? Hello, everyone. I'm Dr. Soumya Saluja from FIP Media, and today we'll talk about how to deal with teen anxiety and depression, and to shed some light on the challenges that the teen's mind encounters. We have with us clinical psychologist and counselor Dr. Manisha Gaur. Dr. Manisha is the director of Gaur Mental Health Clinic, De-Addiction and Heart-to-Heart Counseling Center in Civil Lines, Ajmer. Dr. Manisha has also worked as a clinical psychologist at a number of hospitals, including JLN Medical College and Hospital and Savai Man Singh Medical College and Hospital in Jaipur. Dr. Manisha also has numerous awards and publications to her credit. Dr. Manisha, FIP Media welcomes you, ma'am. As you well know, today's teenagers, they face many challenges. So to start this discussion, I would like to ask that what exactly is teen anxiety and does it always harm teenagers?
So anxiety, basically, when we talk about the teen anxiety, anxiety is the situation when you're very fearful or you're scared something is not going to happen, and then there are some changes in the body. So this is a situation with teenagers due to certain reasons, maybe because of the hormones, or maybe because of the other effects which are happening around, or maybe because of the peer group, maybe because of the task which they are given up. So teen anxieties grow according to the situations around they have, because they're in the age where they need some kind of recognition. And when they do not get that or they are striving for it, they grow with anxiety.
Okay. So are phobias and panic attacks common among teens with anxiety disorders?
So anxiety is usually prevalent. It's usually there in everyone, in all the teenagers. And to some extent, anxiety is okay. If they are a little anxious, they would perform their work. But if they are not at all anxious, they'll be easy and they'll not perform the work and they will not complete the task. So when the anxiety gets in access, and
Yes.
when there is when they are not able to control their bodily symptoms,
Right.
so that time they may get into panic attack. And when certain situation due to which they develop anxiety has repetition of that situation, if somebody is anxious of maybe dark rooms and they have to go and be there, or they have ample certain such situations where they have to be in the closed areas or the dark areas, so
Okay.
that fear grows, and when that fear grows, then anxiety turns into phobia also.
Okay. So as we all know that teen anxiety is rising. So can it be attributed to the increased exam pressure, especially when there are high expectations from children?
Yes, anxiety, exam pressure is also one of the reasons of increasing teen anxiety, because you must have lately heard about many of the suicides happening among the coaching
Absolutely.
institutes.
Yes,
Yeah.
ma'am.
So why is that happening? It is happening because even the teenagers are being expected to perform very well, to clear
Yes.
the examinations or to crack the competitive exams or school exams, boards, and other competitive exams. At the same time, they have their expectation from themselves also, that no,
Right.
I have to do it. They put a target for themselves, and if they are not
Yes.
able to complete that target or reach close to it, they
Yes.
get anxious.
Okay.
So that becomes one of the reasons. Teachers um, pressure, parents pressure, and the colleagues pressure.
Right. So everything adds up to the teen
Everything
anxiety.
adds up.
Right. So aside from exams, can social media and hormonal changes make teenagers anxious?
Yes, social media, of course, does that because, anyways, we talk about internet and internet addiction also many a times.
Right.
So, increased use of social media, of the gadgets, of the phone or the laptop or anything, and
Yes.
continuous watching or continuous being in front of the screen
Right.
uh, gets changes, which develops
Okay.
some problem, which develops anxiety amongst the teenagers, amongst the children. Excess use of internet also increases the anxiety. The rays which are coming from the gadgets,
Hmm.
they stimulates the brain cells, because of
Right.
which they develop anxiety.
Okay. And of course, we've already discussed that hormones do have a
Yes,
significant
hormones
role.
do have, and hormones impact females more than the males, because
Right.
females go through that hormonal change every month.
Right. Right. So they tend to get more anxious.
Yes.
Right. And can we say that a bad lifestyle affects teen anxiety?
Definitely, yes. These days, teenagers, they enjoy the night. They enjoy their nights more than the
Yeah.
days. So
Ab-
they are happy staying awake till 1, 2. They are happy staying, watching movies or maybe Netflix or maybe some other social medias or any other things.
Yes.
So that has changed the circadian rhythm of the body.
Okay.
And the rhythm of the body is basically sleeping well on time around 9 or 10 something, and
Mhm.
having complete 7 to 8 hours sleep for the teenagers.
Right.
So if they sleep on time and if they get up on time, wake up on time, things are going to be quite good for them. They
Okay.
will have a happy metabolism, and the generation of that happy hormones and all those things are going to happen well. But if they
Right.
stay awake at night, the mind also, the brain also needs rest,
Yes. Okay.
and sleep,
And
and
right.
the night time is the best time for that.
Okay. And does that lifestyle includes junk food and this deprivation from
Everything,
not eating
everything.
healthy foods?
Yes, junk food also, not exercising,
Yes.
maybe sitting more, sedentary lifestyle. They're just on their table or chair. They're just lying on the beds. They're
Yes.
not moving, not getting into any sports, and
Mhm.
of course the junk food, which develops that lethargy in them.
Okay. And how can parents recognize teenage anxiety or depression? I mean, what role do parent-child partnership or positive parenting and, of course, family support play in coping with them?
Yeah. So I would want to tell you about the symptoms of anxiety. How can one feel that they are feeling anxious, and how can the parents feel? So when
Mhm.
we talk about symptoms of anxiety, the somatic changes, what they are feeling is like they have some butterflies in the stomach, or hand shaking, or shivering, or perspiration, sweating, right?
Right,
So movement, they do not have that focus. So
right,
certain things, when trembling, all these
mhm,
things, and palpitation, when all
right,
these such things, many such things, when these things are being faced, they can,
right.
and which are continuously happening.
Mhm.
If it happens once is okay, but it is repeatedly happening, that
Right,
can be felt. One can know that they're going through anxiety,
right,
right? And these are the changes which is happening inside, somatic changes, and the behavioral changes, how parents can recognize the
right.
child generally avoids being into social gatherings,
Okay,
sticks oneself to one particular confined area,
right,
not involving much, the behavioral change. Maybe they become more irritable, maybe they become uh, annoyed and
right,
angry, or
right.
shouting on little things. So
Yes.
these are certain changes where they can find that there is some difference in the mood which used to be earlier and which is happening now.
Okay.
Can be one thing what parents can notice.
And now from parents to teachers, so like, what role can schools and teachers play to prevent this particular health condition? And what resources and approaches can the school use to address the teenagers' mental health needs?
So every school must have, I think there should be school mental health program, which schools must include in their uh, curriculum for the teachers.
Right.
Just not for the students, but for the teachers, where teachers are aware of the symptoms, where teachers are aware of the different mental health problems, so that
Okay.
while they are in the class, they can notice the students,
Right.
they can notice the behavior and the changes amongst the
Right.
students and can take them to the school counselor or the
Okay.
psychologist.
Okay. And when should a psychologist be approached by parents for their child's mental health condition?
So, in one of the questions you told about parenting. So,
Yes, ma'am.
parenting is very important. It is very important to make a connect with the child so that they can know their child better. In
Yes.
that case, if parents are just yelling or just getting annoyed or just getting angry, or they're very authoritative that everything should happen according to them, there's
Yes.
no connect, there's no, the good connect is not there among the parent and the child.
Yes.
So in that case, they have to make a good connect so that child can express his or her behavior in front, or a teenager in front
Yes.
of the parent also as well, rather than hiding the situations. So that connect has to be done.
Okay.
After that connect,
Mm.
if the changes are happening, the
Right.
parent is trying to explain the child or help the child, be with the child, or
Mm.
get into other activities, still if the child is not able to control the anxiety, still
Right.
if there is not a prominent change seen in the behavior, the
Yes.
child should be taken to a psychologist or
Okay.
a psychiatrist.
Okay. So thank you so much, Dr. Manisha, for joining us today. And I hope this would help many youngsters and their families. And thank you so
Thank you
much
so
once.
much, Soumya.
Thank you so much, ma'am. And for more such informative videos, please subscribe to our channel and press the bell icon for regular updates. Thank you once again. Thank you so much.